Hey guys, welcome and welcome back to my channel. This is Dr. Prasanjit Das, and today I am here to discuss the topic that is antiseptics and disinfectants, that is for the BSc nursing students and the Bmlt students. So without wasting any time further, let's get into today's topic. So coming to the definitions, first is disinfection. Disinfection means the destruction of all the pathogenic organisms but not the spores. As you can see here, we are having a bacteria which is being destroyed by the process of disinfection, but the spore which you are seeing just below it cannot be destroyed by the process of disinfection. When bacteria, that is microorganism, and spores both are being destroyed, then that is called as sterilization. So sterilization is basically the process in which both the spores and the microorganisms are killed. Now, what is a germicide? So, germicide is an agent which is used to kill microorganisms but not the spores. So, basically, it helps in disinfection. That is, it is not causing the sterilization, but it kills the bacteria, that is microorganisms, hence, it is causing disinfection. So the germicides are classified into two types, that is disinfectants and antiseptics. So disinfectants eliminates the microorganisms from inanimate objects like the endoscopes. Then we have the antiseptics which eliminates the microorganisms on the living tissues. As you can see here, that is we are using the spirit over the skin before doing any invasive procedures such as injection, giving an injection or withdrawing the blood. So here you can see several disinfectants and antiseptics. In disinfectants, we have several disinfectants like household bleach, then we have hydrogen peroxide, then we have formaldehyde, glutaraldehyde. Then in case of antiseptics, we have chlorhexidine, then we have povidone iodine solution, then chloroxylenol, then we have hand sanitizers also. So what is the mechanism of action of the germicides? So they act by various mechanisms. This includes oxidation of the bacterial protoplasm, that is the cytoplasm plus nucleus. So this entire cytoplasm plus the nucleus, so this entire thing is being oxidized, that is one of the mechanisms of the germicides. Then it also causes the denaturation of the bacterial proteins, and it also competes with the essential substrates for the important enzymes which are required in the bacterial cell. So these are the enzymes which are present in the bacterial cell, and this acts on several substrates. So these substrates are being competed by the germicides, and as a result the desired products which are required for the growth of the bacteria is not formed. Now, what is the definition of an ideal germicide? So, an ideal germicide, first, it should be chemically stable. So, it should be chemically stable, then it should have a wide antipathogenic spectrum. As you can see, it should act on different types of microorganisms, that is different types of bacteria, as you can see here. Then it should have a rapid onset of action. It should be non-irritating to the tissues, and it should not interfere with the wound healing. As you can see here, it is an image which shows the wound healing. So the germicide should not affect the wound healing process. Then it should be effective in the presence of organic matter like blood, pus, and stools. Next is it should not be absorbed into the systemic circulation. That is, if it absorbs into the systemic circulation, then it will have systemic side effects. Coming to the classification of germicides. So the classification of germicides is easily remembered by a mnemonic which is called as PharmaGod. So P stands for phenols and related agents, then H stands for halogens and halogen releasing agents, then A stands for alcohols, A stands for aldehydes, R is the surface active agents, that is the surfactants, then M stands for metallic salts, and we also have the miscellaneous. Then A stands for acids, G stands for gases, O stands for oxidizing agents, and D stands for dyes. So phenols and the related agents include phenols, then cresol, then chlorhexidine, then hexachlorophene, and resorcinol. Then we have halogens, which includes chlorine, then sodium hypochlorite, iodine, and iodophores. So iodophores are basically the compound which releases iodine. Then in alcohols we have ethanol, that is ethyl alcohol, and isopropyl alcohol. In aldehydes we have formaldehyde and glutaraldehyde. Then surface active agents, in that we have anionic surfactants and we also have cationic surfactants. So these include soaps, that is the common soaps which we use. Then we have cetrimide, then benzalkonium chloride, and cetyl pyridinium chloride. Then we have metallic salts, which includes silver nitrate, zinc sulfate, and several mercurial compounds. Then miscellaneous, we have nitrofurazone, which belongs to a nitrofuran class of drug. Then we have acids like benzoic acid and boric acid. Then we have gases like ethylene oxide and beta propiolactone, and also formaldehyde can be also given in the form of gas. Then we have oxidizing agents like hydrogen peroxide and potassium permanganate, and different dyes which can be used includes gentian violet, brilliant green, methylene blue, acriflavine, and proflavine. So the factors which are influencing the activity of these germicidal agents includes concentration of the antiseptic. So the higher the concentration of antiseptic, greater will be the effect of the antiseptic. But there is one exception to this, that is alcohol. So it has the maximum effect at a concentration of 70%, and the antiseptic activity decreases over 90% of the concentration of the alcohol. Then we have susceptibility of the organisms. So spores and viruses are usually resistant to many antiseptics, so there will be less antiseptic activity against the viruses and spores. And that is the reason why in disinfection we are not including spores, but in sterilization we include spores also. Then we have temperature, that is with increase in the temperature there will be increase in the antiseptic activity also. So coming to the individual groups of the germicides, first we have phenols and the related agents. Under this we have first phenol, which is one of the oldest antiseptic. It is a protoplasmic poison, that is it acts on both the nucleus and the cytoplasm of the bacterial cell. Here you can see the image of the phenol. Its spectrum of activity is as such that it is bactericidal in nature and it is fungicidal in nature also, but it has poor effect against the spores and the viruses. It also has mild local anesthetic action. This phenol, that is one of the oldest antiseptic, is nowadays not used because it is highly irritant, that is it is corrosive in nature and it can penetrate even the intact skin. So the accidental or suicidal ingestion of phenol can lead to corrosion of the GIT, that is gastrointestinal tract. Then it can cause convulsions, then it can cause hypothermia, and it can also lead to death. So the management will basically be symptomatic. Coming to the current use of phenol, it is nowadays used to disinfect urine, feces, and sputum of the patients, and it also has antipruritic action. As you can see here, pruritus, that is itches on the skin, and it is because of its local anesthetic action that it is having an antipruritic action. Next is cresol, which is also known as methyl phenol. As you can see here, it is cresol. It has the same toxicity level as that of phenol, but it is more effective than phenol. So it is used to disinfect utensils. Then we have excreta. Then it also is used for disinfecting the infected glasswares which are being used in the laboratories. Then we have Lysol, which is a soapy emulsion of cresol. As you can see here, it is used to disinfect the hospital floors, and it is also used as an antiseptic to wash the hands. Then we have chloroxylenol. So chloroxylenol is nothing but Dettol. So chloroxylenol is basically the active ingredient of Dettol. It is less toxic than phenol. It is effective against both gram-positive and gram-negative organisms. It is used to disinfect surgical instruments, that is in the concentration of 6.25%, and it is also used as an antiseptic for skin before surgery in the concentration of 1.4%. Then we have hexachlorophene. It is a chlorinated phenol. So it is effective mainly against gram-positive organisms but has less action against the gram-negative organisms. Here you can see hexachlorophene. Hexachlorophene is actually non-irritating to the skin and it is also odorless. So it is used as an antiseptic to the skin before surgery. It is also used in seborrheic dermatitis. As you can see here, it is used in carbuncles, that is in boils. It also reduces the body odor by preventing the bacterial decomposition of organic material, and hence it is used as deodorant. Then in USA, it was seen that hexachlorophene, which was used to wash the newborn babies, resulted in the brain damage in such babies. That is, the brain was damaged in the newborn babies which were who were washed by the hexachlorophene. Therefore, now more than 3% hexachlorophene solution use is banned in USA. Next, we have chlorhexidine. So chlorhexidine is basically used as a mouthwash. It is effective against gram-positive, gram-negative organisms and also fungi. Chlorhexidine mouthwash is basically used as an anti-plague. That is, anti-plague agent is basically to prevent the plague formation and also used as anti-gingivitis agent. That is, it is also used for the management of the gingivitis. Then some of the adverse effects includes taste alteration and staining of the oral cavity. Then we have a compound known as Savlon. So Savlon is basically a combination of chlorhexidine plus cetrimide, and it is used for the treatment of minor wounds and burns, as you can see here. Coming to the next group, that is halogens. These are basically oxidizing agents, so their mechanism of action is by causing the oxidation. Under this, we have iodine related compounds. So iodine is one of the oldest antiseptics. It has broad spectrum of activity, that is, it is bactericidal, sporicidal, fungicidal, and viricidal. That is, it acts against the virus, fungi, spores, and also bacteria. That is, it causes the death of all these organisms. Its activity is inhibited by the presence of organic materials such as pus, blood, feces, excreta, etc. And its activity is enhanced in the presence of alcohol. The disadvantages of iodine is that it is an irritant and it may delay the wound healing, and it stains the area. It also causes rashes and fever in those individuals who are highly sensitive to iodine. And prolonged use of iodine can lead to a condition known as iodism. So what is iodism? So iodism is basically iodine poisoning, which is characterized by increased thirst, diarrhea, weakness, and convulsions. So the different preparations of iodine which are used includes tincture iodine. So it is 2% iodine in potassium iodide plus alcohol, and it is used to clean the skin before surgery. Then we have Mandel's paint, that is iodine in potassium iodide plus glycerin. It is used topically in the treatment of tonsillitis and pharyngitis, as you can see in the image given here. Then we have Lugol's iodine, that is 5% iodine in 10% solution of potassium iodide. It is used in thyrotoxicosis, that is when there is increase in the levels of the thyroid hormones leading to palpitations, then tachycardia, basically thyroid storm. Then we have iodophores. They act by releasing iodine and they are non-irritant in nature. One such example is povidone iodine. It is used in case of burns, boils, and also used before the surgery for an antiseptic of the skin. Here you can see the Lugol's iodine solution. Then we have chlorine related compounds. So chlorine is bactericidal against gram positive and gram negative bacteria. It also destroys the protozoa and viruses. That is in a very low concentration, that is in parts per million concentration, that is 0.1 parts per million concentration. It has activity against the gram positive and gram negative bacteria, also against the protozoas and the viruses. The presence of any organic matter leads to the binding of the chlorine to them, and thus free chlorine decreases. So as a result, the antibacterial activity of the chlorine will also decrease in the presence of organic matter. Then we have different compounds in which chlorine is present. First is chloramines. These are organic chlorides which release the chlorine slowly. So these are used basically for mouthwash and bladder irrigation. Then we have chlorinated lime, which is also known as bleaching powder, as you can see here. It is basically used for the disinfection of the drinking water. Then it is also used for the disinfection of the swimming pools, then toilets, and it acts by basically releasing the chlorine, and it is highly unstable and also loses its activity on prolonged storage, so we have to use it quickly. Then we have the next category, that is alcohols. Under this we have ethyl alcohol. So 70% ethyl alcohol or ethanol is used as an antiseptic on the skin before giving injections and before starting surgery, as you can see here. And the antiseptic efficacy decreases above 90%. That is, above 90% of the concentration of ethyl alcohol, the antiseptic efficacy of the ethyl alcohol will decrease. And the mechanism of action of alcohol, that is ethyl alcohol, is basically it rapidly denatures the bacterial proteins. And the disadvantages is that it has got very poor activity against the spores and against the viruses. Also, it cannot be used in open wounds, then it cannot be used on the mucosa, it cannot be used on ulcers, and it cannot be used on scrotum because it is highly irritant in nature. Then it is also not useful for disinfecting instruments because it promotes rusting. As you can see here, we have the surgical instruments which are getting rusted because of the use of the ethyl alcohol. Also, because alcohols are flammable, so it should be allowed to evaporate before using any cautery in surgery. So as you can see, this is an instrument that is monopolar cautery. So if we use it even before the alcohol is dried, then it can lead to formation of flames and fire. Then we have isopropyl alcohol, which is more potent and also more toxic than ethanol. In 68 to 72% concentration, it is used as an antiseptic. Then we have the next group, that is aldehydes. They are protoplasmic poisons. They act by alkylation of the chemical groups in the proteins and nucleic acids of microorganisms. So under this we have formaldehyde, that is, it is a gas at room temperature, okay, and it is highly irritating to the respiratory mucous membranes and eyes, as you can see from the pictures given here, and it has a pungent odor. Then it also acts as a carcinogen, that is, it can cause cancer. So OSHA, that is Occupational Safety and Health Administration, has set limits to the exposure of the aldehydes in healthcare workers. This is to prevent the carcinogenesis. Uses of formaldehyde. So formaldehyde gas is used for fumigation of wards and operation theaters. Then 40% solution of formaldehyde is called as formalin. It is used for the process of embalming, that is for preserving the dead bodies, that is cadavers, and also for preservation of anatomical and pathological specimens, as you can see here. Then fiber optic endoscopes and hemodialyzers are also disinfected by formaldehyde. And in dentistry also we use formaldehyde, that is in case of hardening the residual pulp tissue during the root canal treatment, as you can see in this image. Then we have next aldehyde, that is glutaraldehyde. It is a dialdehyde, that is basically it has two aldehyde groups. It is bactericidal, sporicidal, fungicidal, and viricidal at a pH range of 7.4 to 8.5. So the activity is seen only in the pH range of 7.4 to 8.5. It is preferred over formaldehyde to sterilize the surgical instruments, then endotracheal tubes, endoscopes, and thermometers. Then 2% glutaraldehyde solution is also used to treat hyperhidrosis, that is excessive sweating of both palms and soles. Next we have surface active agents, that is surfactants. They act by lowering the surface tension of the solution. So as a result, the solution easily spreads over the bacterial cell membranes. This improved contact facilitates better interaction between the antibacterial agent and the bacteria, and this is how the surfactant helps in the antiseptic property. So the surfactants can be anionic, can be cationic, and can be ampholytic, that is it can act as both anionic and cationic based on the property of the medium in which it is present. Coming to the anionic surfactants, they are basically the common soaps which are used. They dissociate into large anions in the solution, and they are effective against gram-positive bacteria and acid-fast organisms. The microorganisms usually get trapped in the lather which is formed by the soap, and then they are washed away. Examples of anionic surfactants includes potassium hydroxide or sodium hydroxide plus vegetable oil, and then we have sodium lauryl sulfate. Then we have cationic surfactants. They act by dissociating into large cations in the solution, so they are active against both gram positive and gram negative organisms. They are non-irritating and safe to use, but should not be used along with anionic surfactants. Examples include benzalkonium chloride. So benzalkonium chloride, its brand name is Zephyrin. It has got an aromatic odor. 1:1000 solution of it is used for cleansing the skin. 1:2000 solution is used for mucous membranes and denuded skin. 1:20,000 solution is used for irrigation of the bladder and urethra. So as you can see, as we are decreasing the concentration, it can be used for more sensitive structures like the mucous membranes and bladder. Then we have 1:1000 to 1:4000 solution, which is used to store the sterilized surgical instruments. Then we have cetrimide, which is also known as cetablone. That is the brand name of cetrimide. It is very effective for cleaning the wounds. Savlon is a combination of cetrimide, that is 3% plus chlorhexidine, as we have already discussed it before, and it is used for disinfecting thermometers, as you can see here. Then we have dequalinium chloride, which is used as gum paints and lozenges, and we have cetyl pyridinium chloride, which is used as mouthwashes and lozenges. Next we have metallic salts. So under this we have silver compounds which have antiseptic and astringent properties. So astringent property is basically tightening the skin to make the skin feel less oily, and it also stops the bleeding because it tightens the skin. Next in this we have silver nitrate, first one. So it kills microbes rapidly, and the action is prolonged due to the slow release of the silver ions from the silver proteinate. So basically silver nitrate first reacts with the tissue proteins and it forms silver proteinate, and from silver proteinate the silver ions are released slowly, which kills the microbes. So this prolongs the duration of action of the silver nitrate. The uses of silver nitrate includes it is used as an antiseptic in case of oral ulcer. It is used for the prophylaxis of ophthalmia neonatum, eye condition seen in the neonates. And side effect is that it stains the tissues black. As you can see in this image, it stains the tissue black. Then we have silver sulfadiazine. It is very effective against Pseudomonas. So it is used topically to prevent the infection of burn surfaces by Pseudomonas. Then we have colloidal silver compounds which slowly releases the silver and can be used as nasal and eye drops. So here you can see silver sulfadiazine cream which is actually used for preventing the infection of the burn surfaces. Then we have zinc salts like zinc sulfate. It decreases the sweating, so it is a component of deodorant because decrease in the sweating will lead to the production of decreased odor from the body. Then it is also used as astringent and it is also having antiseptic properties. It is also a component of calamine lotion which is used in the treatment of urticaria, that is itching and eczematous condition of the skin. Then we have miscellaneous. Under this we have nitrofurazone which has a bactericidal action but has no action on fungi. It is used topically for the burns and ulcer. It belongs to the nitrofuran class of drug. Nitrofurans are basically antimicrobials which have a furan ring with nitro group. So this is the furan ring to which the nitro group is being attached, and this is nitrofurazone which is commonly used for the management of burns and ulcers and is given topically. Then coming to acids. So under acid we have boric acid and sodium borate, which is also known as borax. These are fungistatic in nature and bacteriostatic in nature. So it prevents the growth of fungi and bacteria, but it doesn't kill the fungi and the bacteria. Aqueous solutions of boric acid are used for irrigating eyes, bladder and vagina. It is also a component of prickly heat powder. So prickly heat is basically an itch which is associated with heat, so it is called as heat rash, and the prickly heat powder is used for the management of this heat rash, and of which the boric acid is a component. Next is systemic absorption of boric acid can lead to abdominal pain, vomiting and diarrhea. Then we have benzoic acid. It is both antibacterial and antifungal in nature. Then salicylic acid. It is bacteriostatic, fungicidal and keratolytic. Keratolytic means it breaks down the outer layers of the skin, and as a result it can be used in seborrheic dermatitis and in psoriasis. Then we have Whitfield's ointment. So Whitfield's ointment is basically a combination of 6% benzoic acid and 3% salicylic acid, and it is used for the management of ringworm infection which is caused by a fungus. So for fungal infections, that is ringworm, we can use Whitfield's ointment which is a combination of 6% benzoic acid and 3% salicylic acid. Next we have gases like ethylene oxide, formaldehyde and beta-propiolactone which are used for the process of sterilization. So ethylene oxide, as you can see, is used for the purpose of sterilization, that is it acts by alkylating proteins and nucleic acids of the microbes. It is highly inflammable and explosive, so it is not used in fumigation process, but it is used to sterilize the heart lung machines. Then we have sutures and cardiac catheters also. Then we have formaldehyde which is used in the gas form for fumigation of wards and operation theaters. Next, we have oxidizing agents. They act by releasing nascent oxygen, which oxidizes the bacterial protoplasm, that is the cytoplasm plus the nucleus. Under this, we have hydrogen peroxide and we also have potassium permanganate. So, hydrogen peroxide is very commonly used. It is a colorless and odorless liquid. And whenever we applied hydrogen peroxide to the tissue, we can see effervescence, that is the release of the gases, that is bubbles. And it is basically used for cleaning the wound, abscess cavities, removal of the earwax, then disinfecting root canals, and it is also used as a deodorant gargle, that is to decrease the odor from the mouth. It can be also used to disinfect contact lens and also the plastic implants. Then we have potassium permanganate. It is present as dark purple water soluble crystals, as you can see in the image, and organic matter usually decreases its activity. The uses of potassium permanganate: first is condensed lotion, that is 1:4,000 to 1:10,000 solution of potassium permanganate, which is used for the purpose of gargling. Then we have 5% solution of the potassium permanganate, which is used as a styptic, and styptic is basically a property in which it stops the bleeding from the cut. So it is very much similar to astringent property. Then it is also used for stomach wash, that is gastric lavage, in alkaloid poisoning so as to prevent the further absorption of the alkaloids which are consumed. Then it is also used to purify the well water. The disadvantage of potassium permanganate is that it promotes rusting and it also causes burns in high concentration because of its irritant property. Then we have the dyes. Under this we have first gentian violet, which is also known as crystal violet. So it is effective against both gram-positive organisms and fungi. And 0.5 to 1% solution of it is used topically for burns, boils, chronic ulcers, bed sores, then oral thrush, eczema, ringworm infections, and gingivitis, that is inflammation of the gums. Disadvantage is that it causes staining. Then we have brilliant green, which is also similar to gentian violet in terms of effect. So it is effective against both gram-positive organisms and fungi, and it is having the same disadvantage, that is it causes staining. And uses are also very similar, that is 0.5 to 0.1% solution is used in the treatment of burns, infected wounds, chronic ulcers, bed sores, etc. Here you can see the staining which is caused by the gentian violet in a particular chronic ulcer. Then we have other dyes like methylene blue, which is used systemically in cyanide poisoning. Then we have acriflavine and proflavin, which are acridine dyes and are effective against gram-positive bacteria and gonococci. So 1:1000 solution of it is used for the management of infected wounds and burns, and we have 2% pessariform of these two dye which are used in the management of vaginitis, that is inflammation of vagina, and cervicitis, that is inflammation of cervix. And finally we have a dye that is known as triple dye lotion. So it contains gentian violet in the concentration of 0.25%, then brilliant green in the concentration of 0.25%, and acriflavine or proflavin in the concentration of 0.1%, which is used in cases of burn dressing. Finally, coming to the nursing implications, that is, we should always use gloves while handling any sort of disinfectant. So with this, I would like to end the discussion on antiseptics and disinfectants. I hope you like the video. If you like my content, please do like, share, and subscribe to my channel, and also press the bell icon to get notified whenever I upload a new video. And I am going to upload some of the questions in the comment, and you can answer them by commenting in the video. So with this, I would like to end this session. Thank you very much.